to CaregiversTrainingVideos.com. Hi, my name is Jose Silva, and I'm your host for today's episode. CaregiversTrainingVideos.com specializes in giving family caregivers the learning tools necessary to succeed in a residential environment. The learning objective during today's episode is how to select an in-home healthcare company when you need more help at home. Home Healthcare Training Corporation used its best efforts in researching and preparing for this video topic. We encourage the viewer to further expand their knowledge on this subject for more accuracy and completeness. Additionally, the demonstration you are about to view is for informational purposes only and not intended as medical advice. Please obtain approval from the resident physician or medical professional prior to using any type of device and physical program. Also, read and understand manufacturer's guidelines prior to operating any devices. We do not assume any liability or responsibility for damage or injury to person or property from any use of information or instructions contained on this website and video. There are many in-home healthcare companies that provide an array of support at home. They are categorized into medical and non-medical in-home care providers. The medical in-home care providers have licensed staff. For example, nurse practitioners, registered nurses, licensed vocational nurses, respiratory therapists, and physical and occupational therapists. They also may have case managers, social workers, and other medical professionals on staff for additional support. These type of companies may assist with wound care, administering medication, respiratory wellness, infusion, and physical therapy, and end-of-life care. These providers have earned a professional degree within their own discipline, and in most cases are required to maintain a professional state license and an industry certification. The non-medical in-home care provider may help with meal preparation, medication management, home cleaning, bathing, incontinence duties, grocery shopping, doctor visits, and many other tasks that may not require a professional license but may need a certification. Prior to contacting an agency, first list all of the tasks and medical care that is needed. Categorize the task and medical care into several levels. For example, Level 1 care may be tasks that do not involve any contact with the patient. This type of care consists of housekeeping, watering the plants, meal preparation, scheduling doctor visits, grocery shopping, home safety, and similar tasks. Level 2 care may consist of more personal care. These tasks are considered in the industry as activities of daily living or ADL care. This level of care involves feeding, dressing, bathing, grooming, oral hygiene, toileting, transferring positions or in locations of patients, assisting with mobility aids, and many more personal tasks. Level 2 type of care may require certification and other state requirements. Check with your state for more details. Level 3 care may be provided only by licensed professionals registered through the state agency. This form of care is administered by medical in-home care providers with a higher level of education, such as nurses, respiratory and physical and occupational therapists. Skilled care on this level may be paid for by private insurance, Medicare, and Medicaid. Now that you have the task and the needed medical care listed into levels, it is time to call several in-home care providers. First, interview 3 to 5 in-home care agencies that service your local area. You may conduct a search on www.localcareprovidervideos.com or your local Yellow Pages. You may also use the internet to search for those types of agencies. Additionally, ask for at least 6 to 10 references. These references should include past and current clients. For example, ask for at least 4 clients from 12 to 18 months ago, 3 clients from 3 to 6 months ago, and 2 clients from 1 month ago. Also, call or visit your local hospital senior center or senior citizens community center. These type of organizations know all the players in the industry and may give you some insight to companies that are being interviewed. There may be an internet report card for in-home caregiver agencies in your local area as well. Also, check with your state caregivers association. You should verify with state, federal, county, and local agencies for licenses and special permits that may be required. At minimum, they should have a federal tax identification number, corporate or limited liability company or limited partnership entity number, and a county or city business license. Review their insurance. Companies should be bonded and have liability and workman compensation insurance. Confirm with your state agency for specific insurance requirements. When you have selected an in-home care agency, ask for a certificate of insurance and request that they have you as an additional insurer. This may reduce your liability exposure. Also, this document should be filed in a safe place. Furthermore, ask for a copy of the contract to review for several days prior to signing. Note any questions you may have and review your thoughts with the company representative. After you have done your due diligence, there are specific questions to ask during the interview. For example, question number 1, how many years have the company been in business? Question number 2, is there a tier cost per hour for each level of care? Question 3, what are the costs per hour for the day and evening shift and weekends? Question 4, what are the minimum requirement hours for each caregiver per day? Question number 5, is the company certified by an accredited agency such as a Joint Commission? Question 6, is the company certified to receive government funding from Medicare or other federal, state, and county agencies? Question number 7, what type of supplies will the company furnish? For example, gloves, wipes, bed pads, or similar supplies. Question number 8, does the company conduct background investigations and alcohol and drug examinations for each staff member? Question number 9, have the caregiver been trained and certified for the required level of care that is needed? Question 10, how long have the caregiver been employed with the agency? Question 11, how will the caregiver be supervised? Question 12, who should you call in case of an after-hour emergency? Question 13, have the caregiver signed a company confidentiality agreement and a company handbook? Question 14, what is the policy in replacing a caregiver for non-performance, not showing up, or arriving on time? Question 15, what is the procedure in handling other complaints? Question 16, what is the cost to purchase the caregiver's contract when you find a great caregiver? Question 17, what is the dressing code policy? Question 18, are caregivers required to wear badges with a photo? Question 19, what are the policies for driving to doctor's appointments and running other errands? Question 20, is there an additional cost for those type of services? Question 21, how many days notice must be given to cancel the contract? Question number 22, are there any other cancellation provisions in the contract? Finally, question 23, will there be a caregiver and medication log for review each day? These are just a few questions to ask, and I encourage you to add several more to the list. What if type of scenario questions should be asked with respects to your specific situation? The tips for selecting an in-home care provider agency and specific questions to ask during an interview can be printed from our download page. That's it for this episode on caregiverstrainingvideos.com. Please visit our sponsor's website for exciting offers and additional information, and email us with your comments at the link below. Thank you for visiting us, and again, I'm Jose Silva, and have a great day.